There is no greater joy than the birth of a child, and no greater tragedy than the death of a mother during childbirth. As often as 1,000 times a day, a mother dies giving birth. The leading direct cause of maternal mortality is hemorrhage. Women rapidly go into shock from hemorrhage, but they die from delays. Delays in finding transport, delays during transport, and delays waiting for definitive care in referral facilities. What can save these mothers is a low-cost, reusable, easy-to-apply first aid device, the NASG, a non-pneumatic anti-shock garment made of neoprene and Velcro. By compression, the NASG stops bleeding and keeps blood in the vital organs during shock. The Safe Motherhood program at the University of California, San Francisco has demonstrated that the NASG buys time that helps mothers survive delays.
Madam, you are bleeding too much. You are bleeding too much. We're going to save your life, madam.
The NASG is a lightweight compression suit made of neoprene and Velcro with 6 segments that close around the ankle, calf, thigh, pelvis, and abdomen. The Velcro fastenings keep the garment on tightly. The abdominal segment, number 5, contains a small foam ball to apply pressure to the uterus. Anyone can be trained to apply the NASG. First, place the NASG under the woman. The top of the NASG should be at the level of her lowest rib, and the row of yellow dots should be along her spine. Starting at the ankles, close segment number 1 tightly around each ankle. Make sure it is tight enough so that you can snap it and hear a sharp sound. Next, close segment number 2. Try to leave the woman's knee free so she can bend it.
Are you okay, madam?
Apply segment number 3, the thigh segment, in the same way as 1 and 2. Apply segment number 4, the pelvic segment, all around the woman at the level of the pubic bone. Place segment number 5, with the pressure ball, directly over the umbilicus. Then close the NASG with segment number 6. Although 2 people can more rapidly close the leg segments, only 1 person should close the pelvic and abdominal segments, 4, 5, and 6, to avoid applying too much pressure. All segments should be applied using as much strength as possible. However, do not close the abdominal segment so tightly that it restricts the woman's breathing.
Are you breathing okay?
If the source of bleeding appears to be uterine atony, administer uterotonic drugs and massage the uterus. The NASG stretches, allowing room for your hand. The NASG adapts to many sizes of women. Here, for demonstration purposes, we are applying it to a fully clothed model who weighs 227 pounds. 103 kilograms. The NASG can also be used on a shorter woman. First, place the top of the NASG at the level of her lowest rib. Without closing the Velcro, check that the ball in the number 5 and 6 panel will be over the umbilicus. Now, move to the woman's feet. Check to see if the NASG extends beyond her feet. If so, then the NASG is too long. To shorten it, fold segment number 1 back inside segment number 2. Then start with segment number 2 at the ankles. Continue with the rest of the segments as on a taller woman. It takes 2 people to apply the NASG to an unconscious woman. Use the same principle as making an occupied bed. Turn the woman on her side. Fold the NASG in half along the dotted line. Fold the abdominal and pelvic segments, 4 and 6, so the Velcro is inside and won't stick. Place the top of the NASG at the level of her lowest rib and place the dotted line along her spine. Push the flat half of the abdominal and pelvic segments with the Velcro folded to the inside under her body. Next, roll the woman to her other side. Have the second person pull out the flat half of the abdominal and pelvic segments. Roll the woman on her back. Recheck the placement of the NASG by placing the ball, without closing segments 5 and 6, over her umbilicus. Then begin closing the NASG, starting at the ankles. The NASG buys time to transport women to facilities where definitive care is given. Ambulance drivers and others who help transport hemorrhaging women can easily learn to apply the NASG. The NASG can be left in place while any vaginal procedure is performed. Surgery to obtain hemostasis can also be performed with the NASG in place. The abdominal and pelvic segments must be open, but only immediately before the first incision. Prepare the operating theater and personnel for surgery. The anesthesiologist or anesthetist must be aware that the blood pressure will drop as soon as the NASG segments are open. Open only segments 4, 5, and 6. Close segments 4, 5, and 6 as soon as the procedure is complete. Using a clothed model, here's how to help a woman in the NASG to urinate or defecate. Slide segment number 4 up and out of the way in the back, which will allow her to use the bedpan or toilet. You may help the woman raise her hips while you slide segment number 4 up along her back. Then slide the bedpan under her and help her into a sitting position. Or you may roll the woman onto her side. Slide segment number 4 up along her back, then roll her onto her back and place the bedpan under her. Help her to a sitting position. When she's finished, lower segment number 4 back into place. Do not remove the NASG. If the NASG becomes badly soiled with blood and the woman needs to keep it on, you may change her into a clean NASG gradually so that compression is not lost. Slide a fresh, clean NASG under the woman. Position it so the top of the NASG is at the level of her lower ribs. Starting at the ankles, open the soiled NASG and roll the soiled number 1 segments up and out of the way. Close the clean NASG number 1 segments on the ankles. Next, open the soiled number 2 segments and roll them up and out of the way. Close the clean number 2 segments. Continue the same procedure with segments 3 and 4. Segments 5 and 6 are the most crucial. To maintain compression, remove these soiled segments and apply the clean segments as quickly as possible. The person standing on the side of the NASG with the foam ball should pull the soiled garment to her. Then immediately secure segments 5 and 6. Put the soiled garment in a biohazard container. The woman is now wearing a clean NASG. Removing the NASG should only be done under medical supervision and with the woman's IV still running. Once the woman's vital signs have been stable at least 2 hours, with systolic blood pressure greater than 90 millimeters of mercury, the pulse less than 100 beats per minute, and bleeding is less than 50 milliliters per hour, you can begin removal. Even though you have been monitoring vital signs, you must take the blood pressure and pulse immediately before beginning NASG removal. Open segment number 1 on each ankle. Wait 15 minutes. Recheck blood pressure and pulse. As long as neither has changed by 20, that is, the pulse has not increased by 20 beats per minute, nor the blood pressure decreased by 20 millimeters of mercury, the rule of 20, move on to open segments number 2 on both legs. Wait 15 minutes. Recheck blood pressure and pulse. If blood pressure and pulse remain stable, remove segments number 3. Then continue with 4, then 5 and 6, waiting 15 minutes between each segment. If at any time the blood pressure drops by 20 millimeters mercury or more, or the pulse increases by 20 beats per minute or more, stop the removal. Starting with the last segment opened, rapidly reapply all segments from top to bottom, and look for the source of bleeding. When the NASG is removed, it should be immediately placed in a plastic, non-leak biohazard receptacle. Always wear heavy rubber utility gloves when handling a contaminated NASG. First, remove tissue or other body materials by scrubbing with a brush. The next step is to decontaminate the NASG. Prepare a 0.01% bleach solution. Bleach comes in different strengths, so the amount of bleach you'll need to make a 0.01% solution will vary, depending on the brand of bleach you're using. The correct mixture may vary from 40 milliliters to 100 milliliters of bleach per 30 liters of water. Refer to this chart, which is in the NASG training toolkit, to determine the correct amount of bleach. Submerge the NASG in the bleach solution for 10 minutes. You may need to place a heavy object, such as a rock, on the NASG to keep it submerged. Next, wash the garment with detergent and cool or warm water by hand or in a washing machine. Do not put it in a drying machine. Hang the NASG to dry. If the NASG is not folded properly, the heavy-duty Velcro will stick to itself or to the NASG and slow down application during an emergency. Place the NASG on a clean, dry surface. Spread it out. Start with segment number 1 and fold it in on itself so that the Velcro doesn't stick to the colored outside material, but is resting on the inside. Fold segments 2 and 3 in the same way. Then fold the leg segments together like a map or fan. Place the leg segments all the way into the abdominal segment. Fold segment number 4 so that the Velcro is lying on the black, not the colored part. Then fold up over the leg segments inside the abdominal segment. Fold segment number 5 across the leg segments. Wrap segment number 6 tightly around segment number 5. Once folded correctly, the NASG is ready to be stored in a clean, dry place where it can be visible and easily accessible. In a clear plastic bag if possible. Folded correctly, the NASG is ready to be quickly applied to the next patient who needs it. If you work in a low-volume facility or at the community level, you may not see enough patients to remain proficient with the NASG. To be ready for an emergency, practice putting the NASG on each other, at least once a month. Then, when a hemorrhaging mother needs the NASG, you'll have the practice and experience to help her.
Are you okay, madam?
The NASG may not save the life of every mother dying in childbirth, but the initial field data, gathered over 10 years in 3 different studies in Africa, show a decline in maternal mortality of over 50% when the NASG was applied. 50%.
Okay.
A simple, easy to apply, reusable, and inexpensive device can save the lives of thousands of mothers every year and help to preserve the health and integrity of their families and communities.